Now we're going to hear from Haruhiro Inoue, the inventor of poem and the inventor of the poem name and the brand. Haru, thank you.
Yeah. Okay. So good morning, everybody. So thank you very much, Stavros, for your kind invitation again to this Winter of Long Island Live. So my disclosure is an educational grant to the hospital, not myself, from Olympus and Boston. So this last 1 year ago, I moved to our new hospital. So this hospital located in Tokyo, not the previous one, it was Yokohama. But anyway, so this is a very nice photo. So when I came here last year, and then it's a very, very funny. So we met together. So in Zurich airport, this was January last year. He is traveling with his family. And then Dr. Chris Gustav mentioned the concept of the submucosal endoscopic myotomy was first reported by J. Pasuricha. Now he's in Johns Hopkins. And then Chris Gustav, Dr. Chris Gustav and Dr. Sumiyama, so they reported the possibility, lots of possibility, potential of the use of the submucosal endoscope, submucosal space to do something endoscopically. So myself started the poem procedure. The first case was 2008. So 7 years has passed since we performed the first case. And then now the indication of the all achalasia. Only exception is a terminal achalasia, which need to be treated by the esophagectomy. And the other motility disorders such as diffuse spasm, nutcracker, hypertensive LES, or some other hypertensive motility disorders are a good indication for this procedure. So approach is very simple. So middle part of the esophagus, we get in a submucosal space and then create the long submucosal tunnel. Normally 15 centimeter submucosal tunnel. The tunnel goes beyond GE junction. And then after creating submucosal working space, so we perform this something. So in a poem, we perform myotomy. And then finally close the mucosal entry using clips. That's all. Yes, our first case was 2008, 7 years ago. So this is the data in our hospital. So far we did 850 cases before I came here, totally 850 cases. This is the data when, at the time of 700 cases. So youngest is a 3-year-old and the senior is a 89-year-old. Of course, patient receives lots of previous treatments, so balloon dilation 40%, Botox injection not so popular in Japan. And then some patient receives a previous surgery. Today's live demonstration also the patient receives a previous surgery. Anyway, and then so average myotomy length is 14 centimeter. Procedure time is 1.5 hours. So this is one of the best indication of the poem procedure. This patient has lots of abnormal contractions in a esophageal body. So junction is also tight. This is not a junction. So later, so you can see a very tight junction also. But in this case, lots of abnormal contractions. So in this case, we have to put a very long myotomy in order to improve the dysphagia symptom. This is LES, very, very tight. Then in this case, we put a very long myotomy from the upper part of the esophagus and going down to the stomach. So totally 23 centimeter myotomy. So this kind of long myotomy, not difficult, in a POEM procedure because we approach from inside. Anyway, this case also, we close the mucosal entry crypts after that, so no abnormal contractions anymore. And then finally, you can see a very dilated lower esophageal sphincter like this. So fortunately, we have no major complications so far. And of course, we have some minor complications, but almost all cases can be treated by just a conservative treatment, mainly elongation of the fasting period. So success rate. So definition of success rate is very difficult. So final score is Eckart score. Final score is a 3 or less than 3. And also we can include improvement of 3 points and more. So our success rate was 95 or 97%, like this. This is a subjective patient evaluation of the procedure. Most of the patient cited a high ratio, high rate of the satisfaction. This is a case of a Chicago type 2. You can see a compression of the body. And then after myotomy, you can see a very smooth passage of the contrast media. This is a type 3 with spastic contraction in the esophageal body. And then after that, so far better passage. We can apply this procedure even for children. So the myotomy length is a little bit shorter because the body is compact. But improvement of Eckart score is dramatic. This is a case of a 3-year-old. So before procedure, the junction was tight. And then we did the POEM procedure, same to adult. And then, so this is right after procedure, you can see a smooth passage of a contrast media through the GE junction. So in this case, 3 years has passed since C receives this procedure. Now C is totally fine. This is another sample, tight junction, 5-year-old. And then the before and after procedure, junction is totally different. And then contrast media passed the G junction very well. Clinical course. Anyway, so now we think the good indication of the POEM procedure for pediatric patient is like this. We can do it in a 3-year-old, but it's technically difficult. So generally, I recommend to the pediatrician to send us a patient more than age of 5 and body weight more than 15 kilograms. We can perform the POEM procedure with very safe side. We can apply this procedure even for sigmoid achalasia, not only early stage. Also, we can apply like this sigmoid achalasia patient. This patient is one of the advanced achalasia patient. So she came to our hospital. She receives a tracheostomy because she choked with food and aspiration pneumonia. And then her esophagus, this is the Japanese food. Anyway, so her esophagus is dilated with some candida. Anyway, so in this case, we performed the POEM procedure. And then, so right after procedure, her Eckart score improved to 6 to 1. The patient said no regurgitation anymore. And then, 8 days after procedure, she discharged from hospital with a regular diet, take out the tracheostomy tube. Another sample. This is another very advanced case of the sigmoid achalasia. So in this case, we perform the myotomy. In those cases, we perform the myotomy in a greater curve of the stomach. That means, when we approach greater curve, so we dissect the his angle totally. So that means most effective myotomy. So very advanced case, most strong myotomy. So we perform myotomy in a greater curve in these very advanced cases. So in this case, muscle layer was very thick, like this, like a ham. But we cut this, and then finally, so we reach the gastric side, and then we cut until the gastric fornix. Okay, at the end of the procedure, it's like this. So in a sigmoid achalasia case, sometimes identification of the esophagogastric junction is difficult. So most reliable procedure to identify GE junction is a double scope method. So like this, we insert the baby scope in a stomach, and then a retroflex view, you can see a gastric fundus, gastric caudier, and then now you can see a submucosal scope. So this means the submucosal scope already reached to the gastric side. So we have already cut all the lower esophageal sphincter. This is a most reliable procedure. This technique was first reported from Chicago to video GIE or something. So this case is like this. So 7 days after procedure, so C also take a food, but so no dilation of the esophagus in the thorax. ECGAT score improvement was good. 3 months after procedure, so junction is dilated, a little bit esophagitis, but no problem for her. 1 year later, I asked to the patient on the phone, and then she said, I can eat smoothly without any trouble. No midnight cough, no more aspiration, and she gained weight 10 kilograms. So her condition is good. So we can apply this myotomy even for surgical failure. So in a surgical failure case, once again, I will approach in a greater curve of the stomach. Now you can see this is a his angle of the muscle. In a submucosal space, we can see a his angle of the muscle. And then after dissection of the muscle, you can see like this. So we have already dissected the circular muscle, and then longitudinal muscle is also split each other. And then behind, bottom of the cut end, you can see a diaphragm. This is a diaphragmatic crus is here. And then we also dissect the gastric fundus. This is the back side of the mucosa. So before procedure, tight junction, and after procedure, very dilated. The patient satisfaction was very high. This is the same kind of video. Okay, I will skip a little bit. And then finally, I would like to mention a little bit about the indication of the, now 15 minutes, 5 minutes more. So I would like a little bit mention about the application of the POEM procedure for non-achalasia motility disorders. So this is a case of a diffuse spasm. So like left side, you can see no abnormality when the patient has no attack. But the patient had some symptom, so esophagus was shrinked, lots of abnormal contractions. And then this is the endoscope examination before the procedure. So we can identify simultaneous contractions of the esophageal body, and sometimes a very strong contraction in the body. But GE junction itself very dilated. So this is a typical case of diffuse spasm. So without contraction looks like this, but sometimes multi-peaked contractions we can see. So in this case, we perform we put a very long myotomy, starting from the patient neck and then going down to very close to lower esophageal sphincter. In this case, a CAT score improved 6 to 0, so patient has no symptom anymore. Okay, this is another sample. This is a case of a jackhammer esophagus. Sometimes we can see like a corkscrew-like abnormal contraction of the esophageal body. But without symptoms, the barium swallow looks normal. But so we perform the high-resolution manometry, 10 times swallow most of the time. So patient has lots of high contraction. DCI is more than 8,000. So in this case, diagnosis is a jackhammer esophagus. So in this case, we perform a POEM procedure. You can see a very thick muscle layer like this. So we cut all the muscle layer down. And then finally, if manometry lower esophageal sphincter function is normal, we preserve the lower esophageal sphincter. So far in our hospital, we experienced 4 cases of jackhammer esophagus. And then after procedure like this, no more contraction, but no more. Originally, the patient has no peristalsis, no good peristalsis. But this is a 10 times swallow. But anyway, barium swallow is like this after procedure. His symptom totally gone. So it's good. And then we can also apply this procedure even for hypertensive areas. Good indication. So, ladies and gentlemen, this is my conclusion. Now the indication of the POEM procedure, at least in our hospital, all achalasia case, and also other motility disorders of the esophagus. Thank you very much for your attention.